your changing body. At home, a fitball is a good alternative to a chair, especially if you're experiencing some tailbone pain. When in the kitchen, position yourself close to the bench or sink. Make sure everything is within arm's reach and turn your whole body when reaching or lifting. Placing one foot on the inside edge of your cupboard can reduce the strain on your lower back in standing by allowing some weight shift and increasing your base of support. But remember, keep the curve in your lower back. Try sitting to do some food preparation. This can save you from becoming fatigued. To pick something up from the floor, maintain your lumbar curve as you lean your body forward from the hips, then lower yourself down onto one knee, providing better support and balance. Hold the object as close as possible with one arm as you use the other hand to push onto your thigh, pushing yourself forwards and up to standing. Always brace before and as you move. Remember to avoid lifting heavy items as they can strain your back, abdomen, and pelvic organs. If you need to move something heavier from the floor, move it in stages, perhaps from the floor to a stool or chair, then stand up and lift the object from the chair. You might find vacuuming to be quite a challenge. Remember your wide base of support. Maintain your curve, bend from the knees and hips, and brace gently with your pelvic floor as you go. Kneeling on hands and knees can give more support as you do cleaning activities, but always remember to have a wide base of support. Maintain your lumbar curve, bend from your hips and knees, no twisting, and brace gently as you go. When you are pregnant, you should not push through pain. Listen to your body and try to plan activities so that you stay comfortable and well. If an activity is causing pain, stop doing it. Think about why this is happening and how you can improve what you are doing. Perhaps you can position or move your body better, or maybe change the task. Sometimes you will need to pace what you are doing. Break it up into manageable portions and have a rest in between. For example, vacuuming, dusting, or walking. Sometimes you may not be able to continue doing the activity at all for now. If in doubt, talk to your physiotherapist.